And that's it. Here we go. Dr. Mimi Vo. I said that correctly, didn't I?
Yes,
Okay.
hi.
I always second guess myself. How are you today?
I'm good, thank you. Thank you for having me.
Yeah, I really appreciate you taking the time out of your day to sit down with me and talk. We're here in your office and during your lunch hour, nonetheless. So,
Yes.
do you eat lunch or do you fast typically, or like what's your day
I
like as far
usually
as?
do eat lunch. I gotta eat lunch and breakfast, but I
Yeah.
had a really hearty breakfast this morning, so I'm good for a little bit.
Okay. All right. I really appreciate you, kind of missing on your lunch there. So, um, we'll jump right into things. I know we're a little time
Sure.
crunch, so I wanted to sit down with you because we both recently attended the Mo Cann
hmm
Expo at the Union Station Hotel here in St. Louis,
hmm
and you were there as a speaker, and you represented, I think, a couple different organizations, correct?
Yes,
So I don't want to
correct.
misspeak on like what all you represent. So for the
Sure.
listeners, could you just kind of just tell them who you are a little bit, and then like why you were there?
Sure. So I'm Dr. Mimi Vo. I'm an internal medicine physician here in St. Louis. I've been practicing for 15 years, and I got involved with the Missouri Cannabis Trade Association. It was started about a year ago. I'm one of the initial members on the board of directors, and I am in charge of the Healthcare and Education Committee. So I am the chair of that committee. And our focus is to educate, and the platform is to really go out and educate physicians and others in the healthcare industry because I have identified that there's a real need for education. It was even as somebody who believes in cannabis as a medicine, and it was very hard for me to find materials to educate myself. And because I was able to go through that process, I thought that I could help to educate others as well. And especially with Missouri coming on board as a state where medical cannabis is available, I feel that patients are going to talk to their doctors about it, and the doctors need to be educated on it. So that's one of the things that I've been working really hard at. And I've spoken at Mercy South Hospital. I have a speaking engagement at the University of Missouri, Kansas City, which is my
Okay.
alma mater, to residents and students and faculty there. And then um, I've also spoken at other engagements as well. I'm speaking to the Multiple Sclerosis Society on
Okay.
Monday, so that's really exciting. And also throughout the state, we have engagements in May and June to go to Springfield and Cape Girardeau and different places around the
Yeah,
state.
yeah, that's excellent. Just kind of getting the word out there and
hmm
educating, the healthcare providers.
hmm
So I've noticed because like I'm a health coach and I talk to a lot of people and I've read a ton and just listening to podcasts and just educating myself, I've noticed a lot of the real time information that's coming out, it takes a while to filter itself into like the academic system and like
Yes,
and some doctors are just their workload is so heavy and they only have so much time.
that's
Like they're
true.
not educating themselves on these
That's
things.
true. So first of all, I think that we are not taught at the basic level in medical school. 90% of medical schools do not teach the endocannabinoid system or
Right.
cannabis at all, and that's conversely on the opposite side. 62% of pharmacy schools do teach it. So it's
Really?
62% versus 10%. So actually, the pharmacology world is far ahead in educating their students and their staff. So first of all, there's a lack of education from the medical students onward. Second of all, because it's still a Schedule One drug,
Yeah.
and the hospitals and different institutions do accept federal dollars for research and to supplement the residency programs and whatnot. They don't want to touch it, so they're worried
Yeah.
about losing their funding. And then there's also that stigma that's there, and the lack of understanding on why it became illegal in the first place. And so those are the concerns I get from physicians when I speak to them. That they think there's not enough research out there, which there is. And then they say, well, if there is, then why was it illegal to begin with? So they don't even want to touch it and look into it.
Yeah, I've noticed a lot of people they want to use the scapegoat of the law to
hmm
justify like why something is as opposed to really like
That's right.
looking at it and asking themselves like, hey, is it right? You know
That's
what I mean?
right.
Like, is that
Yeah.
actually, does it really make sense? And I guess once you've been taught something for so long, I mean, it's just
hmm
ingrained in you as a
Yeah.
child.
Yeah, and the Marijuana Tax Act that came out to essentially make marijuana illegal back in the 1940s, it was a long time ago. And so the people who are practicing medicine today have not seen it used as a medicine. So
Right.
so they don't know that it is effective or helpful. And then on top of that, take in a day where you're seeing 30 patients, where you don't even have time for yourself or your family,
Yeah.
and to take the time out to educate yourself on something new is, and something where you should be educating yourself already on all these other things that you do on your daily basis. It's
Yeah.
hard to find that extra time to educate doctors.
Yeah, for sure. And it must be a challenge because well, I was really surprised that you said that, the pharmacy schools they actually study it
Mm-hmm.
because I mean, we're med- and correct me if I'm wrong, medical school is essentially following like a pharmaceutical model, correct? As far as, and maybe I'm misspeaking, but I feel like a lot of what doctors do, depending on the doctor, is oftentimes they're bogged down by so many patients, and they have to, they have bills, they have
Mm-hmm.
student loan debt, and they have to see so many people, and oftentimes they're just prescribing medications to like fix a symptom,
Mm-hmm.
and not really addressing the root cause.
I think that's just a part of what we do. I think, first of all, as physicians, we're scientists, so we're detectives. We're given a few different symptoms, and then we have to go dig and find out, okay, based on these symptoms, what's our differential diagnosis? And
Hmm.
based on these diagnoses, which ones may kill our patients first? We have to rule those out first,
Right.
and then we find out, okay, based on this list, now this is what we think is going on. Let's treat this. So I think the treatment is a part of it. It's a science, but it's also an art
Right.
form. But that's only one part of what I do every day is seeing patients who are here for sick visits. Many of my patients are here for well visits too. So it's preventive care, talking to people about getting their mammograms and their colonoscopies
Hmm.
and their pap smears. And I do that even when they come in for sick visits. It's my practice to do that on every single visit. So the preventive care, taking care of their symptoms and their diagnosis and treating that, as well as their psyche. I feel like a lot of my patients follow me because I take the time to reassure them or talk to them about some underlying depression or anxiety that they may not want to talk about, but once treated, they're so much happier,
Yeah.
So it's so complicated. And so in one 10-minute visit, how do I address all of these things?
Yeah.
It's
Yeah.
very difficult. So that's why I'm always running behind.
Yeah.
And I don't get to see as many patients as as I need to pay the bills, but I'm happier that I'm doing something that's right. I'm taking care
Yeah.
of patients the right way,
Yeah. Are you
you
the
know.
exception though?
I've been told that by many of my patients that
Yeah.
I am a rare breed, but I have the luxury of being on my own. I'm in private practice, so
Yeah.
I don't have administrators breathing down my necks. But at the same time, I probably could be doing a better job of making ends meet. But I feel like personally that my health and my happiness is worth a lot.
Oh,
So
absolutely.
so
Well,
I'm happy practicing medicine the way I feel like it should be practiced. So
yeah, absolutely. I'm a big believer in just building the life that you want to live and
yeah,
just making it work. So
yeah.
I can definitely appreciate that. Now, what is required for doctors as far as continuous education, like once they go into
Yep.
practice?
Once we go into practice, it's 25 hours of continuing medical education per year, or 50 every 2 years. And it needs, if to keep our certification, for example, in internal medicine, then I need to keep those 25 hours in internal medicine. And so they'd have to be things that related to, diabetes, heart disease, high cholesterol, and things like that. So, for example, I'm double boarded, so I'm board certified in internal medicine, but also board certified in the treatment of obesity. So
Okay.
in obesity medicine, so I have to do the hours for both of those to keep up my certifications. So when you deal with something like that, let's say it's a urologist or a surgeon, then doing continuing medical education on cannabis may not help them for those hours that
Yeah.
they need. And some doctors, they just do it because they want to learn more, and some will use that towards their hours if they can find a way to justify it or whatnot.
Yeah. Yeah. Man, that just
And
seems like a very conflicting situation, right?
yeah.
Because we know, at least anecdotally, I mean, there's definitely research being done, and we're
Mhm.
getting more and more research now that laws are changing, which is
Mhm.
awesome. But it would just seem like a lot of doctors, they might just take certain continuous education classes just to meet that standard and not
Mhm.
necessarily try to improve themselves
Yeah.
when natural things like cannabis or lifestyle or diet change,
Mhm.
and really adjusting like the gut
Mhm.
microbiome, for example,
Mhm.
has been shown to just address a ton of issues.
Yeah. And I think that's because let's say diabetes, for example, new medicines every day, new therapies every day. And when we think about, okay, my 30 patients I see a day, 10 of them have diabetes. Well, that's the one that I'm going to gravitate towards because I feel like I need to keep up on this. And there's so many things to learn as a physician.
Yeah.
There's so many things that we have to keep up with that something that is more obscure, we may put to the side as well, I'll get to that one day. That
Yeah.
sounds interesting, but I'll get to it one day. I've got to do the things that I have to help my patients first.
So what guided you towards like cannabis and more natural remedies?
So, I've been seeing more and more in the last few years patients who come to me. Once actually it became adult use was available in Colorado and California and in Washington. I met patients who would travel there and come back and say, my migraine headaches were very well treated by this, or my anxiety is so much better, I'm sleeping so much better, but then it's not available here. Or they will say, doc, I did bring this home,
Yeah.
And because I think that I have a very good rapport with my patients, that they're willing to tell me that, and then see what my reaction is.
Yeah.
And the more that I hear about it, the more I kind of got interested in, is this a medicine? And I started digging myself and looking into the history of why it's illegal and those things. And I've always loved history. I believe history repeats itself, and it gives us a guide of how to live our lives. And so I went and looked into the history of it. And during this time, about a year and a half ago, I have a very close family friend in Houston who was diagnosed with cancer.
Okay.
And we knew that his cancer was incurable, and his family and I were talking about what kind of things we could do to help him. And then I started digging a little deeper, and I started looking at the research and what is available for different cancers and tumor suppression and things like that. And that's when I was like, wow, this is really amazing. And I started reaching out to other physicians who have been using cannabis as a medicine for their patients solely as a practice. So met with Dr. Jeffrey Hergenrather, and he came here to speak actually, and set up a consultation between my family member from Texas. He flew in from Houston, and we met with Dr. Hergenrather. And it was amazing to see, somebody who's been practicing this. And in California, he's had so much more experience than,
Right, yeah. I mean, it's been medically since 96.
1996.
Yeah.
And then I just started doing deeper dive, and then I became involved with the Missouri Cannabis Trade Association, and then started my platform of, well, I'm now starting to get educated myself. Well, I'm going to start educating others too.
Yeah.
And as I talked to other doctors, 9 out of 10 doctors that I talked with in St. Louis were like, I don't know anything, and I don't really believe that there's anything here. And, and they would say, it's not going to pass. Amendment 2 is not going to pass. And then when it passed, everybody's like, okay, come, they called me, like, tell me more about this. It's passed. It looks like a lot of patients are for this.
Yeah.
Can you start educating me? So that it was a little bit different after
Complete
the
180
vote.
there, huh?
Yeah.
Yeah, man, it's definitely good to see things change. The laws have been against cannabis for so long, and you mentioned diving into the history. Would you care to share some of the history for the folks a little bit? I know it can get
Yeah. So cannabis was a medicine throughout the ages, initially in China and in India, even, it was brought by Dr. O'Shaughnessy over to the West, and it was used for Queen Victoria for her menstrual cramps. And in the United States, it was available as a tincture, and a lot of pharmaceutical companies actually created tinctures, and they were available over the counter, similar like you'd buy, aspirin or Tylenol or whatnot, used for a multitude of things. So sleep, anxiety, abdominal pain, nausea, lots of different things. So it's somewhere around the 1930s or so, 30s and 40s, there was this alcohol prohibition was there. And when alcohol prohibition stopped, then there was this push, well, what do we do? Who do we go? We need to go after someone. The DA had just been created, and so then they started really looking at cannabis as something to go against. Also, at the same time, cannabis was called cannabis back then, but a lot of people from South America and from Mexico were coming and working, and they were smoking it. And prior to that, it was more tinctures, and
Mm-hmm.
so it was also a racist issue.
Yeah.
They then changed the name to marijuana,
Yeah.
and because that was the term that was being used by these farm hands and these workers coming from Mexico.
Mm-hmm.
And then also people in the African American community were using it, so they were seeing it being used in jazz clubs and saying
Yeah.
that, this is what's going to happen to our society. Everybody's going to go to these clubs and use it recreationally, and so then that's when the Marijuana Tax Act was started, and I think it was 1942, and that tax act said that if you were going to prescribe it, so if you're a physician, you could prescribe it. If you're going to produce it, if you're going to manufacture it, then there is a tax that's placed on it. And it was an equivalent of today. It's a higher amount of our dollars today,
Mm-hmm.
but it made it so doctors, it was a hoop they had to go through. They had to
Yeah.
fill out the forms, they had to do all of that. And so they said, well, we're just not going to do it. We're
Yeah.
not going to, if they're going to put a tax on it, we're just not going to write it anymore. And the American Medical Association was against it. The president wrote a letter and said, please don't do this. This is the medicine that we're using for our patients.
Yeah.
And around the same time, morphine was produced.
Mm.
So then it was like, well, if you're going to make it so hard for us to write for cannabis, well, we're just going to write for morphine, for
Yeah.
pain instead. And so then that whole change happened where now we're using opiates a lot more for pain and whatnot. And then we had the whole war on drugs.
Yeah.
And then, so actually, there was a case, I believe, that went to the Supreme Court that said that this Marijuana Tax Act is illegal.
Yeah, wasn't
And
it's kind of like a catch-22 if I do remember right. It's like you had
right.
to do all of these things,
Hmm.
but to actually get it, like you actually had to have like cannabis. And then so it's like, all right, well now you have cannabis without this, like a certain, or maybe I'm
Yeah.
confusing
Well,
it with something else. There was some sort
there
of
was it was regarding that this tax act was said, like, you cannot just pick one medicine and say that you have to go through this hoop with it and whatnot. So the Supreme Court actually said yes, it's illegal, and so
yeah.
then that's when the DEA scheduling was started,
Okay.
and so then they made it a Schedule 1.
Yeah.
Yeah, but at this, also because industrial hemp at the time was being used. So there is some other things as far as people wanted to use wood and paper for
Right.
for the newspapers,
Right. And we're
instead of
talking
the
what's his name? I know Harry
it,
Anslinger was
Harry
with the
Anslinger was
DEA.
in charge of the Federal Bureau of Narcotics
Yeah.
and
Uh,
controlled substances, and it was the
oh,
Rockefeller
oh no, William Randolph Hearst.
Hearst.
Yeah,
Yes, William Randolph
the
Hearst.
decorticator was invented, right, which helped with hemp, and he had
Yes.
stock in trees and papers
Uh-huh.
and
And the Canadians actually owed him money, and if he and so it was that trade. He could get cheap wood and to make paper for
yeah,
his newspapers and magazines, and so he really didn't want hemp around.
yeah, and
So
then enrolls all the propaganda with
yeah,
marijuana and
yeah,
reefer madness, and
yes, yeah.
man, it's a
And
crazy thing to think
and
about.
Anslinger has been on record before alcohol prohibition was stopped, saying that, oh, cannabis is not a big deal, it's not addictive and whatnot. And then right afterwards, he completely changed his stance.
Right.
And
Yeah, and just said what he had to say, whether he
yeah,
believed it or not, I would imagine.
yeah.
Yeah, that's crazy. And then all these years later, it just kind of completely stifled research. I had a thought, and this is kind of when you started your research for cannabis, or with your family member who had cancer, right? And you came across
Hmm.
cannabis. Did you come across anything as far as like psychedelics and some of the research that's happening out at MAPS and like psilocybin for end of life treatment and different things?
Yeah, so I've met with Dr. Sue Sisley, and she
Okay.
does some of the MDMA research for PTSD, and she does the cannabis research for PTSD in Arizona, and she's seeing some really good results with
Right.
MDMA
Right.
for PTSD in small doses. And she's able to phase 2 trials with it, whereas with cannabis, she's only on phase 1 because
Hmm.
of the stigma of it.
Right.
but I have not done a deeper dive as far as looking at
Okay.
psilocybin and other
Yeah.
things.
Yeah, it's just one of the areas. I'm just always looking at just different natural compounds and
Mm-hmm.
different things. I know they're just with Rick Doblin and everything out at MAPS. They're
Mm-hmm.
just doing so much. I think they're on maybe phase 3 with psilocybin
Are they
on their clinical
really?
trials, but they're
Wow.
doing a lot with MDMA and different things. So I was just curious if
Yeah.
maybe that came across your research or not.
No, not yet.
Now, whenever I was listening, because you did a brief interview with my buddy Justin Bricker
Mm-hmm.
at the Expo. Shout out
Mm-hmm.
to the Justin Bricker, the Why Not
Mm-hmm.
podcast. And you mentioned that you grew up, your family was just traditional Eastern medicine herbalist, correct?
Yes, so my grandfather was an herbalist. He was a naturopath, and he grew up in a central region of Vietnam. So it was in the late 1800s, early 1900s, where he was well known in that region in his village and would travel to other villages, and people would come to him. And he used traditional herbs to treat a multitude of illnesses. At that time, there wasn't Western medicine. When there started being Western medicine, he started educating himself on it too. But he sent my dad off to the big city. So he
Oh
sent him
yeah.
to Saigon when my dad was, I believe, 13 or 14 to live
Okay.
with his older brother who was in high school there. And he was kind of groomed to, go and learn more about Western medicine. And my dad then went to medical school when he was 18
Okay.
and graduated as a physician. And he was in the South Vietnamese army as a physician, and at the end of the war, then became a refugee, came to Hong Kong and then to America, and met my mom on the plane from the refugee camp
Oh wow.
to America. So yeah, they fell in love on the airplane, and
That's
then
cool.
came here. And my father then. My mom's family was she was one of 8 children, with her mother, and they were sponsored by a church in Springfield, Illinois,
Oh
and that's
really?
where I was born. And moved to St. Louis when I was very little, when I was
Oh wow.
3. But my dad did his residency here in St. Louis, so then we
Okay.
moved here when I was
So
very
you've
little.
kind of been groomed to be a healer since you were very young.
Yeah, I actually, it's interesting. We're here in my office, but my sister, she's a physician too. She's a nephrologist,
Okay.
and when we were little kids, this is what we did. We came to the office and we helped work. We worked here since I was very young. So like 9, 10 years old, I'd be here telling patients to sign in, copying charts and things like that, volunteering at hospitals at a very young age, just very being interested in it. And I told my parents somewhere around I was like 2 or 3 that I wanted to be a doctor, and they never let me forget that.
Really?
So,
That's awesome. Yeah, man, it's just it's so important to instill in kids like just like what it takes to pursue what they want. So that's pretty cool
mhm,
that you were exposed to that at a young age.
yeah.
Um, oh, I just had a thought. So whenever you're seeing patients, like what's the process like as far as, discussing their options in cannabis and how that may help them?
So, when I see patients for different things, for pain, I only have a couple of things that I can use. I've got my Tylenols, my anti-inflammatories like the Aleve and Motrins.
And
I
there's
have
issues on
my
like their liver and different things with those,
yeah,
right?
yeah, and then I have the anti-epileptics or the the medicines for nerve pains,
Mm-hmm.
and then I have muscle relaxants, and then I have opiates. So there's only certain things I can do, and if the patient has an intolerance to anti-inflammatories because of GI issues, or the some of the muscle relaxants make them too sleepy, or, there's certain things that I'm like kind of checking off now. I can't use this, or I've tried this and it's not working. Then, I haven't been able to now, but I will be able to then offer, well, let's try something else.
Yeah.
Let's try cannabis. I do have a patient who is, he's a Buddhist monk. He's
Oh wow.
about 85 or 88 years old, and I've been seeing him for years. But one day in the office, this is a few months ago, I said, and he would be younger than my grandfather. So I said, in Vietnam, back in that day, I know cannabis was used, and did you see cannabis used as medicine? Like, what do you think?
Yeah.
And he said, yes, cannabis was used as a medicine in the early 1900s. And I said, well, did you guys use it for pain? He said, yeah, I remember it being used for pain. And I said, medical marijuana laws just passed and it's going to be here. And he said, do you have some? Can I have some
He was
for my
ready.
pain? Because he has bad arthritis.
Yeah.
And I said, no, I don't have any for you now, but it's going to be something that'll be available in the future, at least as an option.
Right.
So,
Yeah, which is really good. Have you been able to, I don't know, discuss? So I think of things like if we're adjusting like inflammation, things like CBD can help with inflammation
hmm
or can help address the gut or things like turmeric or different things like that. Are you allowed to like discuss these options with patients, or
Yeah,
is that
yeah.
something that you do?
Absolutely. So I am able to. I used turmeric when I was little. If I had a cut, my mom would take turmeric and, it would be in her freezer and she'd break it off and then
Just
like
rub it on
rub it
there.
on me. So, um, but yeah, I'm able to discuss herbal medicines with patients. And there are things that I'll say there's good data for. And patients come to me all the time and say, I'm taking this. What do you think? And then I can say, well, this, as far as it being harmful, I don't think it's harmful. The good quality research is not there, but if you feel like it's helping, then that's okay.
Yeah.
Um, a lot of my patients are of a Vietnamese ethnicity, so they tend to use herbal medicines a lot more
Okay.
anyway.
Yeah.
So
Is there any research on oil of oregano?
yeah, I've not seen that research for oil right now,
Okay,
but
I
I'm
didn't
gonna
know if
have
there
to
was,
look into
because
that.
I know it can be used as like a natural form of like an antibiotic, and
Mm-hmm.
that has like antimicrobial properties to it and
Mm-hmm.
different things. So I didn't know if
Yeah,
there's any
and like
research or
similar to
not.
green tea. Green tea has some anti-inflammatory
Mm-hmm.
and antimicrobial
Yeah.
usages as
Yeah, and a
well.
lot of people can address a lot of the issues stemming from those just by
Mm-hmm.
addressing their inflammation. I
Yeah.
found, and just kind of fixing their diet. I'm just so big on
Yeah.
just fixing your gut. I found so many things can just
Yeah.
really be helped just by that.
I love that you're a health coach. Actually, one of my au pairs. He's a nanny of mine that is here from Vietnam, and I put him through health coach
Oh,
classes
okay.
because he did the Dr. Sears health coach program,
Okay.
and because he's interested in that, and I am too. And
Mm-hmm.
especially with my, I had the board certification in obesity medicine
Mm-hmm.
last year or 2 years now. But that's been a big focus of mine is really changing people's diet and exercise and that helping with the whole person,
Yeah.
helping with many other things and
Yeah.
getting patients off of their blood pressure medicines and their diabetes medicines. And it's such a wonderful feeling to be able to get somebody off their insulin,
Right.
as they're losing weight and they're doing better.
Yeah.
It's
And
wonderful.
that's, yeah, I love seeing that. And that's one of the things that I'm so passionate about, because I found, like, through podcasts, like through books that are being released, it's a lot of the researchers that are actually doing the work now, and you can get this information in real time.
Hmm.
I mean, so many doctors that are releasing their research, and it's just amazing, like, what you if you take the time to actually learn the real information, like how you can actually apply it to your life and help yourself.
Yeah,
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 so it's really
absolutely.
powerful stuff. How much time do we have? All right, it's 12:45. Okay. I think we're doing good on time. I think we're doing good on time. Now, with the limitations on research, like, how much do we know right now as far as like the different cannabinoids, and how those break down and how they help people?
Yeah, so there's about 100 different cannabinoids, and there's some evidence of certain ones helping for certain illnesses. We're looking into a lot of the different terpenes and the terpene profiles, and really, I've spoken to some of my patients who understand a lot more about this or are using this already, and they're finding that the isolates, like the THC isolate, the CBD isolate,
Mm-hmm.
and bringing in the terpene isolates, creating it as a medicine, is just not as helpful as the whole plant.
Like the full
So
spectrum.
the full spectrum, the whole plant, because I believe that there's a lot more that's yet to be found and a lot more that's yet to be identified. And so the whole plant is really helping a lot more than these isolates and creating these different
Right.
tinctures out of isolates.
Yeah, I mean, like you said earlier, I mean, we have the endocannabinoid system, which is,
Hmm.
endogenously, like, it's built into us, like, it's there, and we have these receptors for these compounds, and
Yeah.
they work best together,
Hmm.
is what I've seen.
Yeah, and there's other things that also boost our own endocannabinoid system. So, anandamide and 2-AG are our own cannabinoids that we create, but exercise will increase those. So there's that the runner's
That runner's
high
high.
is not just endorphins; it's also cannabinoids. Teas, like cocoa or the chocolates, kind of give
Hmm.
us that increases our endocannabinoids. So there's different things that are helpful, and I think it's like I really talk to my patients about living just a healthy lifestyle,
Yeah.
staying active. And I tell people, like, park far away, walk in more, staying active will help, our joint fluids and reduce arthritis pains and
Yeah.
just different things and eat less chemicals. The I come from, like I said, the Vietnamese background, but a lot of our foods are not processed. We are from a very young age are taught to buy healthy, vegetables
Like
and
real
cook
whole
it, and
foods.
and yeah, and fruits are a dessert.
Hmm.
Usually it's like after dinner, everybody eats fruit as a dessert, and it's a healthy lifestyle.
Yeah, and that
It's
that'll
important.
yeah, that'll go a long way. And things like getting enough
Hmm.
water and
Yeah.
sleep.
Yeah.
Are you able ever to, or are you ever able to talk to your patients about like stress reduction or anything like that? I mean,
Oh,
obviously you only
yeah.
have like a 10-minute session,
Yeah,
so
absolutely. And I talk to patients about that a lot because I will have a patient who comes in with, for example, chronic dizziness, and I've really ruled out all of the serious causes of chronic dizziness. Um, and I can just see their anxiety. And so I will just sit them down and say, you know, tell me about your worrying, your constant worrying. Like, tell me about your sleep. Tell me about your appetite. Tell me what's going on in your life. Who do you live with?
yeah.
What kind of problems are you having with your children or your spouse? And sometimes then identifying the root cause is that stress. Like they'll say, well, I work two jobs and I, sleep 5 hours a night. I'd love to sleep more, but I just can't because of whatever, because of work or whatnot, or
Yeah.
waking up early because of the kids. Um, and really helping them with that,
Yeah.
that to identify the stressor, reduce the stress, and then that helps them with whatever symptom it is that can be brought on by it.
Yeah, yeah,
You know.
yeah. You really are one of the rare ones, Dr. Vo. I mean, you're doing like a complete holistic, approach to health with your patients. So that's
Oh,
really
well,
powerful.
thanks. So we talked about the other institution that I'm a part of
Yes.
is the Society of Cannabis Clinicians, and it's a group of doctors that was founded 20 years ago. The Dr. Hergenrather is the president, and he's just recently stepped down. And Stephen Robinson, is now the president of the SCC, or the Society of Cannabis Clinicians. But it's a group of doctors who, similar to myself, really want to bring forth research, good quality research and data, and also share data with each other. So if these doctors have been doing this for years and have a very large patient panel, and then can help each other out as far as dosing, what recommendations are, what new research trials are available, and then doing research themselves. So I just recently got accepted to be part of their board of directors.
Oh,
So it
nice.
was really
Congratulations.
amazing. I met Dr. Hergenrather back in, I guess it was in November or December, and really just kept that conversation with them. And he just said, I would love for you to join. So now I'm a volunteer for them too.
Oh,
So
excellent.
I'm a part of their international committee to help to spread the word internationally as well.
Yeah.
So Dr. Hergenrather just came back from Australia, where he was in conferences there to bring the data that we have and the research we have in the United States to Australia. But they have on their website, anybody can become a member. They have, health coaches will become members, or pharmacists, or psychologists. Anyone who's interested in learning more data about cannabis. They've got videos to watch and a library that has different articles. Like, for example, there would be nephrology articles or whatnot. But one of my initial places that I learned from was through them. It was the Medical Cannabis Institute, and their CME that's on there for doctors is created by the Society of Cannabis
Oh,
Clinicians. So,
nice.
so it was great to meet Dr. Hergenrather, and we had a board meeting, and the board of directors. It's once a year, and it was in California, Dr. Hergenrather's home. He has a ranch in California, close to Sonoma,
Okay.
in Sebastopol, um, and got to meet all these wonderful doctors from across the country who
Yeah,
are
it's
doing this.
it's exciting times to see that
Mm.
we're able to spread that message across the world, and
Yeah.
you're seeing laws change in one country after another, and
Yeah,
it'll be
medical marijuana just got passed in Thailand, and it's on. It's being talked about in the Philippines as a
oh, nice.
possibility coming up, but it's already available in medical cannabis is available countrywide in Australia, in England, in the UK. Um, so yeah, it's really exciting. But there's this gap of knowledge that just needs to be filled in.
Right, yeah,
So.
and thankfully we're slowly filling that in. Have you come across any research as far as like negative effects of cannabis?
So yes, there is. There's some withdrawal symptoms. So the withdrawal symptoms are pretty mild, more similar to tobacco withdrawal. So
Like
your
physical or
irritability,
mental withdrawals?
mental and physical. So I think the mental is more of a some cravings. Some patients do have some cravings and more of irritability. So and that's for chronic daily users will
Yeah.
have some irritability or whatnot with stopping their cannabis. There is a worry with psychosis, and it's higher in young males, but and so we're always a little worried about using in patients who have a history of psychosis. If they have a
So
history
what
of
do you mean
schizophrenia,
psychosis? Oh,
like hallucinations
okay.
and really mood disorders with
Yeah.
it, and it is higher propensity in young males. But there also is a higher incidence of schizophrenia in young males. So there still needs to be fleshed out
Yeah.
what the true incidence is, although albeit low, and there is on the books about a 9% risk of addiction is what
Hmm.
we have, although some of that may be confounded by the fact that some of these people don't really feel they have addiction or are seen to have an addiction, but they have to go through an addiction center because of work or whatnot. So there
Yeah.
it may be lower.
Yeah. I
Um,
sometimes, excuse me, I sometimes wonder if that's just like a character trait or if that is like an actual thing of the plant with certain things because like you can become addicted to and not to say it isn't because it could
mhm,
very well be, but
mhm.
like you can be addicted to like gambling, for
Right,
example. So
there's a
sometimes I
true
just
gambling
wonder
addiction,
that.
and some of people, I mean, I can identify who I think may have more of an addictive personality,
Yeah.
and it's familial too. So if you've come from a family with more addictive personalities, I see that. And,
Yeah.
I have patients I just talked to today who was addicted to alcohol, and then he had some really bad issues where he was hospitalized, so he's able to get off alcohol, but now he's addicted to his opiates,
Yeah.
so
It's just,
it's like somebody that I knew had an addictive personality, and I'm trying to get him now weaning off the opiates that he was started on in the hospital.
yeah.
But
Yeah, I was just, you know, and because I have definitely been guilty of maybe putting like rose-colored glasses on, like, oh, cannabis is just all great, and like
mhm,
there's no negative side effect to it. But then I listened to a really good debate on the Joe Rogan podcast pretty recently, and one of the guys was talking about, just like you said, how people who tend to be maybe bipolar or schizophrenic, like if they do have too much cannabis, it can kind of just put them over the edge, so to speak,
mhm,
and
yeah.
there's like a snap.
Yeah.
Yeah,
And short-term memory is an issue. We
yeah.
see that too. But then there's no risk of like a true overdose. There's no
Right, the
risk of
LD50
overdose.
is
So,
like insanely high.
yeah. So I don't think that it'll be effective for every single person.
Right.
Some people may try it and they can't handle the side effects because some of these trials, there are people who then will be in so they'll have placebo versus the medicine, and some of them will withdraw from the study because they couldn't handle the short-term memory, or they can't handle the sleepiness from it.
Yeah.
So it's not a cure-all for every single person, but as a physician, I believe it should be an option. Give me
100%.
that option. Similar to any of the other medicines I use. Tylenol may be effective for some people and not for others, but I have that option,
Yeah.
to be able to use that for my patients. And my patients should have that option to try it.
Yeah, yeah. And the
So,
more natural options you have, the better is the way I
yeah.
look at it.
I was at a speaking engagement last night. It was actually a CME hour. Dr. Patricia Herford, she is also a board member for the Missouri Cannabis Trade Association, but she gave a talk at Missouri Baptist Hospital on cannabis
Okay.
as a medicine, and we. And she just, the audience was mainly physicians, and there were a lot of these different questions about, the concerns about psychosis, concerns about addiction, and different things. But as a pain physician with an Illinois license, she's actually been able to see patients for this in Illinois, and she is seeing patients get off of their benzodiazepines, so getting off Valium and Xanax, getting off their anti-epileptics for their nerve pains, and reducing their opiate use or stopping their opiates altogether.
Yeah.
So, I mean, and then she said they're using less antidepressants. They don't need, medicines for sleep, and
Yeah.
so it's really helpful for many patients. It is helpful where they can reduce many other medications that they have to take.
Yeah, 100%. And I think of like the sleep medications, like you don't really get restful sleep with those. You just become unconscious.
Yeah.
So at least with cannabis, you'll actually get restful sleep. Like you can enter your REM sleep and you can
Hmm.
actually have that restorative effect.
Yeah.
Have you, one more question, because I know we're running low on time. Have you come across any research as far as like the effects on the brain and like BDNF production or anything like that? Has that come across in your studies?
I have not. I've not seen a lot of
Oh, okay.
harmful effects, and what are
Well,
you
not like
discussing?
harmful effects, just like, so from my understanding, so BDNF, brain-derived neurotrophic factor, the
Yeah,
growth factor for
yes,
the brain,
yes.
like CBD does help with
Right,
that
right. So
production,
there are
correct?
studies for its use in, Parkinson's disease and Alzheimer's dementia, and that's why the U.S. has a patent on it as a neuroprotectant to
Right.
protect those nerves. And I think that there needs to be more research available for that. And one thing, I get a lot of people saying, doctors don't want to research it. It's not the doctors. It's not the doctors. We want to research it. And but so Dr. Sue Sicily, for example, when she went out to start doing cannabis research, she lost her job. University of Arizona fired her,
Whoa.
and because she wanted to do cannabis research, and so
Hmm.
then she had to start her own research foundation, and she was awarded, I believe it was $1 or $2 million from the state of Colorado. They had a surplus in taxes because of all the money that they had
It's
from
just coming in.
cannabis. They had this money that they put aside for research, so they gave her this research for her foundation to do the PTSD research. So she did the research along with Mayo Clinic. Or was it? I take that back. It was Johns Hopkins.
Okay.
So she was given cannabis from the University of Mississippi, and that's the only place where it's given for research with NIDA, with the National Institute of Drug Abuse.
Hmm.
And when she got it, it was ground up. She said it was leaves and seeds,
Low
and she's like
quality.
very low quality. And so she, had it taken pictures of it. It made the media. Her saying that this is low quality. My patients aren't going to benefit very much if you're using this versus what I've seen in the dispensaries, which is much higher quality.
Yeah.
And Johns Hopkins dropped the study. They
Whoa.
said, you should be lucky they're even letting you do this. You should be lucky they're even giving you any cannabis at all to research. Why would you go out and, have bad press about it? And so they dropped the study because of that. And so,
Hmm.
and she's one physician she's so headstrong, and she's really out there doing it despite all of the hurdles. Not very many doctors are willing to go past those hurdles, even if they want to. They've got kids they have to take care of. They've got a
Yeah.
family they have to care for, or they, they're not willing to take that risk to lose their
Yeah,
job.
yeah, because it's still a bit of a risk of, even though things are
Yeah.
changing, we're still in that weird
Mhm.
gray area where it's not totally socially acceptable, and there's still a lot of education left to be
Mhm.
done.
Yeah,
So,
absolutely, and that's what I'm here to do with Mo Cann Trade.
yeah,
Educate doctors, the healthcare industry, but also patients.
yeah,
So it's exciting. It's an
yeah, it is
exciting
exciting.
time.
I appreciate all the work that you're doing. It's very important. So
Well, thank
it's
you.
awesome that we have doctors that are on board and trying to help,
Thanks.
help educate rather. So I'm gonna turn the floor over to you
Mhm.
if you want to tell folks, any, how they can get a hold of you, how they can ask questions, direct them to any websites or social handles or anything like that. So,
Sure,
yeah.
sure. So, my office is the Vo Medical Clinic. I will say that I have a lot of patients, and I, I, I may not be able to take on tons of patients, but I'm here if anybody, needs a primary care physician. I, Missouri Cannabis Trade Association is mocantrade.org. We are trying to put together a Find a Doctor page. So if, I can't see you as a physician, we are hoping to together a page
So you
where
have a
there's
whole
going to be
network.
lots of physicians that will be willing to certify patients who can help with that. We're working on possibly creating an app for that as well, so that you can find a doctor on the app. But as I go around the state and meet more physicians, I'm compiling a list that hopefully we can then share with everyone. Society Cannabis Clinicians, their website's cannabisclinicians.org. They do have a Find a Doctor page, which there was like one doctor from Missouri, and now I last logged in, there's like six. So I think
It's
we're
growing.
it's growing in membership, and hopefully that would be another way to find physicians that might not be on our page through Mo Cann Trade. Um, I think June 4th is when patients will be able to start getting their certifications filled out. It will take you have 30 days then to submit it to the state, and the state will start accepting them July 4th. So that will be the day when we start being able to get patient cards. I will say though, being in the talks with those who are in the industry, medicine probably won't be available till April to August timeframe, just because licenses won't be awarded till December 31st.
Hmm.
It'll take 4 to 6 months to get up growing
Grow
and
and harvest.
processing and all of that. So I don't think you have to run out to get a medical card, right now those cards are good for 1 year. I think it's $25, good for 1 year. So we have time to wait.
Okay,
But say,
and I'm sorry to cut you off.
no,
And
no,
they just have
it's
to renew that card yearly? Is that
yeah.
how that works?
Mm-hmm.
And
Mm-hmm.
as far as the process of application, do they just have to go see their doctor and the
Mm-hmm.
application process is done there? Is that how that works?
Yeah, so the patient will need to see their doctor and review the medical records, and then the doctor will then fill out a form. It's yet to be identified whether it's going to be a paper form or it'll be electronic. It sounds like the state is trying to do most things electronic, so I think that'll be a little bit easier. But the doctor will then just need to say, yes, this patient has hepatitis C, or yes, this patient has chronic pain and using opiates, and then sign it, and that is then submitted, and then you should get a card within 30 days is what they said.
Okay.
And if they have, it's interesting in their draft regulations, they said that if they can't go through your application within 30 days, for example, if they have too many to go over and they don't have the resources to go over it, then they automatically give you a card.
Oh, really?
And then next year they'll review it.
Oh,
So,
I guess they're probably anticipating the influx of applications right at
yeah,
the jump.
yeah.
Great. So, hey, thank you so much
Mhm.
for all that information.
Absolutely.
It's been very helpful. Yeah, thanks again.
Thank you. Nice to
It
meet
was nice to
you.
meet you as well. All right, everybody, until next time.